Jack was brought in because he was straining for 12 hours. Right now I gave Jack a little bit of anesthetic, so he feels really good. Not anesthetic, actually a tranquilizer. Jack was straining, and if a dog's straining, then you always want to look at the rear, because maybe it could be anal glands, they're pushing. Sometimes they can have a bad back, and if you just press your fingers like this and they tense up, it could mean that their back really hurts. And also, twisting Jack around. Also, you can actually feel in the stomach to see if they're really tense in the stomach area. That can mean a full bladder they can't empty. It could mean also that they have discs or arthritis in their back. But if we lift up the tail, Jack's got a very painful mat there. You should see an anus, and you don't. All you see is a clump of hair. This is a fecal mat. What happened is they get a little diarrhea, or they try to push out some stool, and it gets all the hair around the anus to form a nice mat. And I'm not going to touch it without gloves, because I know that grosses out everybody, and I should have gloves on. So, didn't touch. So let's wash that up. Let's wash that up with gloves, and let's see how Jack does. When you work on a dog or a cat, you have to be careful that they're going to not be happy with what you're doing. We're doing things to them that hurt sometimes or is uncomfortable. We always try to use tranquilizer and sedatives, but we don't always want to give them anesthetic for every reason if we think the pain's going to be very brief. But we have to protect ourselves, because I've been bitten a couple of times in my 30-year career, and it takes a long time to heal, and I'm sure the older I get, the longer it will take. So you always have to protect yourself. Now, Jack's been tranquilized, but I just want to give you a method of putting a muzzle on a dog. What you do is you get a piece of gauze and you put a knot, you make a little loop like that. And that loop goes around their mouth. So in Jack's case, you tie it, and you don't want to cover his eyes, because Jack's got a lot of extra hair, which you'll see in the anal area too. So you tie it like that with the knot above, then you tie with the knot below. So a knot below, like that. Not a knot, but actually just tie a loop. So now I tied it above, and then I looped it under the jaw, and I tied it below. And then you go behind the head and you tie it like that. You have to make it pretty tight, or they'll get it right off. And sometimes a dog will paw immediately. They'll paw like this, and they'll pull it off. So when you put the muzzle on, then you have to hold them to make sure it stays on. But always be careful, because you can really get hurt. So for those of you that wonder what the best part of my job is, this doesn't rank with the best part, but I'm still helping poor little Jack. And what I'm going to do first is I'm going to soak this little mat, because if you try to do too much right away, it's gonna cause a problem. So let's soak it. It's pretty darn hard right there. So we're gonna soak it and give it a little while and see. And Jack, it's hurting, because he's got not only does he have this big plug here, but he's got diaper. I'm just gonna see if I can. We are soaking it. Oh, it's starting to come out now. Poor Jack. So we're gonna get this out. That's one big turd, but he's still got this big mat. But at least he doesn't have that big old mass pressing. But he's probably got a irritated raw rectum from all this. From all the irritation from the fecal, because I don't know if any of you have ever had diaper rash, but as a child, or can even a rash as an adult around your anus, but it can't feel very good. So I'm just now we're getting all the fecal material away, and then look at, oh, there's the anus. See how red? Let's get a light on there, Isabel. That's where the pain's coming from. This lining of the rectum is just terribly inflamed. So that's where he's very painful. Is this rectum here is just terribly inflamed. You can see the blood vessels from this fecal mat has been causing irritation and inflammation in this area. As you film it. What we're going to do is continue washing all that stuff off there with nice soap and water, and then we'll put some cream on it and shave it up. Make sure he's going to need a nice little anal grooming to make sure it doesn't happen again. Okay, and then we're going to wash the area with some warm water. Flush it all off. I know, Jack, I'm sorry. I know it hurts. It's gonna be just another minute, I know. I have to do my little haircut because if they've got long hair, it will get on the oozy rectum part, oozy anus part, and it will mat up again. So let's clip the area. Get rid of all the rest of the poop too. So we're getting rid of the poop, and we're not cutting we're trying not to cut actually, or trying to scrape the anus, just around it. And then we're going to put some ointment on it. So this is a veterinary ointment that's got cortisone and also antibiotic, and it will really help with this pain and swelling. So, okay, little Jack, that looks a lot. That anus is and rectum is a touch happier than it was when I started, and we'll use some pain reliever for a few days, and possibly an antibiotic to make sure there's no infection. So, I hope you weren't too grossed out, but this is one of the jobs that you aspiring veterinarians, you have to do. And it's not bloody, but it's gross in another way. Have a good day.
Well, I hope that that didn't gross you out too much. That's probably one of the grossest videos I put in. If you might think some of the bloodier ones you might think are worse, but something about poop and matted up hair and a butt and the view of an anus real close like that is kind of a little bit scary. So I hope it didn't scare you, but that's kind of the thing I have to go through on a daily basis, is treat things that are kind of gross, but you know, I really feel like I'm helping the animals, so I really, really enjoy it. One of the things that cause dogs to strain and cats to strain are anal gland problems. Can cause them to feel like they have to poop because they got pain in the butt area. They can actually be constipated if they've eaten a lot of bones lately. Eating a whole bunch of bones all at once can kind of cause some cement poop, and they can't get that out. A bad back will cause them to strain because they arch to take a poop, and when they do that, it's painful, and so they sit there and you think they're straining, but actually they're just cramping. Poor things arch and get in position, and then they get a cramp, and what in the heck are you going to do now? And then straining to urinate. A dog or a cat can have bladder stones or urethral stones, and they strain and dribble out. Nothing comes out of their urethra, or they can't go pee real well, or they just have a few drops. So those are all things that cause animals to strain. Anal glands, constipation, urinary problems, back problems. And then what you really should check for too is just make sure your animal doesn't have a big bunch of hair covering their butt and making it like cement. And, well, not like cement, but a bunch of hair covering the butt and getting all solidified and making a patch or a barrier to the poop coming out, because underneath it it's real painful and really inflamed. But anyway, you have a good day and be glad that didn't happen to you. And check out Dog Dish Diet. It's now a Kindle. The way you feed your dog just makes a biggest difference in the world. And your cat. Cats do better eating canned food than dry food. Dry food doesn't do anything for their teeth. If your cat's obese and has flaky skin, then feed it canned food. And if your dog's obese, you can dilute the dry food by adding water or green beans. You can also feed canned food. You can home make food. That's all in Dog Dish Diet. Anyway, well, have a great day.